What kinds of symptoms should my friend look out for in the future?
So along with headache, there are some other symptoms that patients with IIH report to us. Some of them get neck pain when the pressure is very high. They also get things called pulsatile tinnitus. Pulsatile tinnitus is a noise. Yes, this noise in your ears that sort of replicates your heart beating, and often sometimes people only hear that at night when they're lying down and it's quiet. Some of the other things, such as transient visual obscurations, we've talked a little bit about, but often people can get blurring of the vision and different sort of symptoms with their eyes that we kind of don't know enough about, and we'd say it's sort of kind of non-specific. It doesn't seem to relate to severity of the disease. Occasionally people get double vision, particularly when they look in the distance, they see a doubling of the image or a separating of the image.
That makes sense. And there are some other non-specific symptoms as well, which I think we're becoming more and more aware of. Things like general fatigue, we're mentioning the pain coming down the shoulders.
Memory problems as well.
Memory problems as well. And research is now being done to sort of quantify and see how much memory problems relate to raised brain pressure. So there are some other symptoms that really could be symptoms of a number of different conditions, not just IIH, but we're beginning to realise that they are there in IIH, but it doesn't mean it's definitely IIH because they can occur in other conditions as well. So there's pain in the neck, the back pain, the general fatigue, the memory issues, often low mood and anxiety. We quite commonly see that in IIH
kind of associated with
They're associated with it, but not only in IIH, it could occur in other conditions as well. So hopefully that's given you a good rounded idea.
It sounds like it's almost a diagnosis of exclusion, but trying to figure out what to exclude.
Yeah, and certainly there's a strict diagnostic criteria for IIH. So we have a diagnostic criteria by Friedman et al. From 2013, which is the most up-to-date one. And actually we've had diagnostic criteria for this condition for nearly 100 years now. And over the time it's been modified and updated. And what we're really doing is we are specifying that the brain imaging has to be normal with no, like we talked about, no brain tumour or bleeding.
My MRI was just completely fine.
Yeah, normal MRI. And we often do a scan of the veins of the brain as well to exclude any clotting or blood clots in the veins. Then we would often go on to do a neurological examination to check that there weren't any other abnormal neurological features, except for the double vision, which we know about. Then we might go on to do the lumbar puncture. And I think I'll talk to you in a bit more in detail about that in a minute when we talk about your lumbar puncture pressure. But certainly we would generally do a lumbar puncture at the beginning and also check that the fluid from the lumbar puncture is normal. So that hasn't got any signs that there's infection or inflammation. So those things coming together are really the diagnostic criteria for IIH. So that helps us to know that we've got the right diagnosis.
Thank you.